Welcome into this segment of For the Children, and joining us today is Dr. Michael Ramsey, and we're discussing viral infections of the skin. Now, Dr. Ramsey, first off, welcome to the program. Now, talk about what some of those may be.
The two most common things that we see in pediatrics are warts, which most people are very familiar with, and then another infection called molluscum contagiosum, which is super common, more common than warts, but most people don't know what they are.
What is it?
Well,
I don't know.
molluscum is caused by a pox virus, and so it gives you very tiny bumps that are about anywhere from 1 to 5 millimeters in size, and they look like little pearly domes with a little belly button in the middle, a little dimple in the middle. And so they are very common in children. I would say about half the children in this area have them. All 3 of my children had them when they were younger, and so I really diagnosed it about 3 or 4 times a day. And so it's something that is very common, but nobody knows what it is.
Okay, do you treat that kind of like a wart?
To be honest, you don't have to treat it with anything. Most of them will go away, but it can sometimes take between 6 and 18 months. And so as you can imagine, if you have something there that can sometimes spread, parents get concerned about that. Most people recommend, if it's not in a cosmetic place like the face, or it's not somewhere that's getting irritated or infected, to just leave those bumps alone and they'll go away on their own. There are some therapies that they can do at the doctor's office. Sometimes we can apply a little medicine to make it blister up and go away, but you usually have to do it multiple times over multiple different treatments because they come back and they spread.
Okay, now moving on to warts. I had one when I was a kid.
Sure.
Would not go away. Tried to freeze it, went to the dermatologist, and used the duct tape method.
Right.
Well, I mean, there was everything. What works on those?
You know, home remedies for warts have been around forever. I mean, if you look in Tom Sawyer, Huckleberry Finn threw a dead cat in a graveyard to get rid of his wart. And so
somebody bought mine.
Right, and so there's all kinds of home remedies there. What most people recommend to try first are those over-the-counter things, like the Compound W or your salicylic acid preparations, putting those on every day and keeping them covered because that increases their effectiveness. Duct tape has come into fashion. Some people recommend leaving a piece of duct tape on a wart for about a week, letting it dry overnight, and then reapplying it. Warts can last between 2 and 3 years if left untreated. When you treat them, though, they can still take 2 to 3 months to treat. And so you don't have to do anything with those again, unless if it's in a cosmetic place, or especially in kids, sometimes kids will tease other children about that. And so if it's becoming a problem, then I would suggest talking to your doctor about it and see what other kind of therapies are available.
So it's not a terrible thing, but it is something you could get checked out.
Right,
to
exactly.
help get rid of it.
Exactly.
Very good, very good. Well, thanks for joining us again today.
Thank you for having me.
And for those of you at home, if you have any questions about our segments, always send us an email at morning@WTVY.com. We'd love to help you out any way we can. Also, if you'd like to watch this interview or past interviews again, log on to that web channel, WTVY.com. All right, here's a look. The sun is